Okay, I think we're going to go ahead and get started. Good morning, everyone. It's good to see some familiar faces today and some new faces today. I do feel like, Terry mentioned this last week, but I do feel like this has become like a Wednesday morning habit and Wednesday morning meetup time for a lot of us who work with kids and families every day. And so this has become like a real comforting thing. I know, at least for me, and hopefully for some of you, to see some other familiar faces, every Wednesday at 10. So I am Jessie Whittish with Kentucky Youth Advocates. And thank you all for joining. As always, please feel free to add any questions or comments that you have in the chat feature. Or if you just want to say hello to one another, please send out a chat. Today, we are going to talk a little bit about healthcare, health access, and health equity in Kentucky in the wake of COVID-19. And several of you submitted questions via the RSVP form. We are going to address some of those in the presenters' remarks and the panel today. There were a couple of really specific questions that we are going to actually do some individual follow-up with you on, so stay tuned for that. Just a little Zoom housekeeping. Right now you are all muted, and we'll just have folks stay muted throughout other than our presenters. So if you have a question or a comment, just use that chat box. It's also helpful because we'll save any questions or comments you have in that chat box to communicate with our presenters as follow-up, or communicate with decision makers, or to post info on our issue tracker, or all of that stuff. So I am going to turn it over to Mahak Kalra from Kentucky Youth Advocates, and she is going to get us started this morning. Mahak?
Thanks, Jessie. So hi, everyone. It's like Jessie said, it's great to meet so many of you all virtually. I know that there's a lot of familiar faces and also new people that I'm meeting virtually. So hello again. For those of you who don't know me, I'm Mahak Kalra. I'm the Senior Policy and Advocacy Director here at Kentucky Youth Advocates. And as Jessie mentioned, today's virtual forum will be discussing healthcare, health access, and health equity. We know this conversation around the health sector has changed quite a bit since we initially spoke in our first virtual advocate forum. And we thought it was timely to revisit this topic this week in particular, because it's on the heels of our Making Kids Count podcast taping around health. And we know that such progress has been made around this sector. We at Kentucky Youth Advocates have said thriving communities launch strong families, and strong families launch successful kids, and successful kids launch a prosperous future for Kentucky. So our conversation may seem like it has a singular sector focus, but we know health is a cornerstone foundation that intersects among cross sectors. And so that's why our focus really here today is just around health equity, health access, and healthcare. So our flow of today's conversation is a bit different from our past ones. We'll have opening remarks from Department of Medicaid Services Commissioner Lisa Lee, followed by a panel discussion with health advocates who've been champions for children for many years. So one of the panelists joining us today is Veronica Cecil, Vice President of Policy at the Foundation for Healthy Kentucky and former Deputy Commissioner of Kentucky's Department of Medicaid Services. We also have Dr. Donna Grigsby, Chief Division of General Pediatrics at UK Healthcare. And last but certainly not least, Dr. Nikki Stone, Dental Director at the UK Norfolk Valley Community Health Center in Hazard. That's a mouthful. But welcome, and thank you all for joining us. We're really excited to have you here today. Commissioner Lee, before I turn it over to you, I just want to say that we're really grateful for you to be here this morning. You know, you've been a true champion for Kentucky's kids, and we know this time is certainly busy for you, so we appreciate you joining us here this morning. So I'm going to turn it over to you.
Thank you. Very, very happy to be here, and good to see some familiar faces and some new faces. Definitely COVID-19, this health emergency has turned our whole world upside down, and it has changed the way that we operate, particularly in Medicaid. We have weekly calls with our managed care organizations and other interested parties, and our conversation always begins the same way, is that the key word is flexibility. And the three goals, the three priorities for the department during this time is, number one, making sure all individuals can enroll in Medicaid. Number two, once they enroll in Medicaid, they need to have access to services. And number three, we have to pay our providers in order to have a provider network to treat these individuals. So to that end, we have a lot of flexibilities. For example, we have a presumptive eligibility process now online that individuals can fill out and get access to Medicaid very easily. We have waived the resource and asset limit for presumptive eligibility for individuals to come into the program. So we're streamlining the eligibility process, not only for individuals out in the community, but for our long-term care facilities. We know that those facilities are being hit hard, and that eligibility for age-blind and disabled individuals is very complex, to say the least. So we are streamlining those processes. Additionally, we have broadly expanded our telehealth capabilities to allow providers who have the capability to do either Zoom, FaceTime, Skype, even telephone. We have expanded that flexibility across our whole provider type and are encouraging providers to provide services via telehealth. And we have seen a huge increase in our managed care organizations claims related to providers who are performing telehealth services. So those are some of the things that we're doing in Medicaid. We work with CMS to obtain all flexibilities that we can. Early on, we had an issue. We had some provider types, particularly those individuals who needed early intervention services. They didn't believe that they could deliver the services by telehealth. So we streamlined all of that to make sure that all of our children who are enrolled in our First Steps programs, even HANDS individuals, they participating in HANDS, which is the Health Access, Nurturing, and Development Services, home visitation, they can also perform services via telehealth. And not only are we doing a lot of telehealth, we do have some providers who have closed their doors but are open for emergency purposes. And I have to tell this one story. It's a good story, I think. We had a child who had an abscess tooth, and they couldn't find a dentist. They did find a dentist, but the dentist that they found in their community did not take their managed care company that they had assigned to them. So they called the department, and within less than 3 hours, we had that child switched. We had them with another MCO, and they got in to see the provider. And I think that was a really good story. Those are the kinds of things that we're doing in Medicaid just to make sure that individuals have access to care. We also are working very closely with our managed care partners, and they are relaxing a lot of their policies and processes, particularly as it relates to prior authorizations, co-pays. There are no co-pays right now. There are no prior authorizations on any services except for pharmacy. We do have some pharmacy prior authorizations for very expensive medications, but some of that has been released. We've been doing early refills and even 90-day refills on certain medications to prevent individuals from having to get out and go to their pharmacy on a routine basis. We've also, as we have all of this great stuff, we still have some concerns. For example, this morning I heard on one of our leadership calls that there's some anecdotal information out there that we may be losing some of our children because individuals either do not or cannot have capability for telehealth. For example, some parents don't want the camera in their home. And in other areas, such as rural areas, individuals may not have the capability, the broadband, or the access to services. So when we hear that, we're doing pretty much everything we can as far as our EPSDT, Early Periodic Screening, Diagnosis, and Treatment Program. Of course, that's for children under 21, and it also is a process where individuals get their well child checks, children get their well child checks. We are allowing those to be performed by telehealth, and then later on the individuals can come in and get their immunizations. So we are working with providers to make sure that all of our vulnerable population have services, particularly our children, get the services that they need. And again, flexibility is the key word. We're contacted daily by provider groups wanting to know what else they can do to expand services. And we're keeping an eye on our provider network. We're a little bit concerned about some of the providers who are losing reimbursement because they don't have the foot traffic in their offices, and they're not, either cannot or will not do telehealth. Also keeping an eye on some of those providers ready to retire, and this may push them into an early retirement. So again, we're keeping an eye on not only what we have to do now to provide access to services and provide reimbursement, but trying to plan on what this is going to look on the other side. How are we going to have that provider network to take care of our members, and what can we do to shore them up right now? So we've been doing a lot in Medicaid, and I think I can stop there and see if there's any questions or if there's anything else you specifically would like for me to address based on what the department is doing and seeing right now.
Thank you, Commissioner Lee. I know we did have a question regarding the types of platforms that allow for telehealth, and I kind of briefly gave an overview, but just to confirm, Commissioner Lee, if you don't mind, can you discuss the platforms?
For telehealth?
Mm-hmm.
So we have developed, we started out with an FAQ that was related to telehealth, and we add to that every day now. We've taken it, it's no longer a telehealth FAQ, but all providers. But providers can deliver telehealth via any means of communication. That the HIPAA compliance issues related to some of those platforms are also relaxed. So providers can do telehealth by the normal method that they do telehealth, but they can also do telehealth services by Zoom, Skype, FaceTime, and they can even do telephone contacts and bill for those. So we have provided instructions on specifically how to bill for those services, and all provider types can do this. We are seeing a big spike, particularly in the behavioral health area. And we think that that's something that's going to continue given just the uncertainty and the anxiety that a lot of individuals experience during this time. So again, pretty much all provider types and any kind of communication that they can do between them and the member.
Thank you for that. There was an additional question as well. Under what circumstances might someone lose Medicaid coverage right now?
That's a very good question. Glad you asked that. We are not terminating anyone right now. The only way that they could lose Medicaid coverage in Kentucky is if they move out of state, or of course if they pass away, their Medicaid would be terminated. But we are currently extending out into the end of June. Everyone who is in Medicaid right now will remain eligible, and we continue to reevaluate that.
Thank you, Commissioner. And I do want to take a second to show my appreciation for you and your team, because I know right now communication has been rampant among your team, and that has been great and helpful for me in particular, so I could share the message with other advocates across the state. So we can't thank you enough for your leadership.
Thank you. And I think that my team, they make me look good because they're the ones out there doing everything. We have some really wonderful folks in place, and I have to say that this administration, I mean, from the top down, we have individuals, for example, the Secretary of the Cabinet, who has how many years, over 30 years with the Cabinet, who they know the system and they know our members and our providers, and they have really big hearts. And I think right now, again, keyword being flexibility, and they're doing everything they can to make sure that our members know we're there for them. And we have had a little bit of an issue with our presumptive eligibility, and just because of the way the process, the eligibility card that comes out is an 8.5 piece of paper, and it does look suspect. So we had some, particularly pharmacists, who didn't want to accept that presumptive eligibility card. So we've been doing a lot of communication about presumptive eligibility, and I think anything our advocacy groups such as Kentucky Youth Advocates can do to help promote the presumptive eligibility process, that would help us too. And because we're all in this together, and we so appreciate your partnership right now. This is very valuable for us.
Thank you, Commissioner Lee, and we're happy to share any messages that you and your team put out, so thank you. We are now going to move on to our panel discussion. So one of the first questions that I'm going to ask our panelists is, as you all have heard in recent headlines across the country and state and our daily communications briefings by our governor, there are certain populations that are being disproportionately impacted by COVID-19. So how can we be sure that our health delivery systems and services being provided address the racial and social economic inequities? Veronica, do you want to start off?
I'd be happy to do that, and thank you for having the foundation be a part of this, and for your all's work around Kentucky's youth, and especially during this time highlighting information like this. What we know is systems historically have been built and policies have been put in place that have created some institutional barriers. There's been a lot of studies on that, a lot of research on that, and I think really what it boils down to is what really can we do, not just in a pandemic like we're going through right now, but in the future, what can we do to try to address those disparities? The foundation, I just want to mention quickly, in January, the foundation had started its own immersion in health equity. It's part of our mission to improve health equity, and we had just started a year-long immersion into health equity because we wanted to focus more attention on it in the work that we do and in working with our partner organizations. So we had just gotten that started and had a kickoff meeting in January, and we put that a little on hold because what we're doing now is taking that effort and trying to focus specifically on what's going on around COVID-19. And we're in the process right now of doing a little bit of a deep dive into that. I don't have that specific information yet to present today, but some of the things that we do know is, first of all, we appreciate the governor starting to highlight those disparities in the data. We need to make sure that we're collecting that data, that it's consistent, and that it's not an afterthought. And so the collection of that data is very important. It has to be able to inform us on what is going on so that we can take that information and turn that into policy. So right now, I think it is important that we make sure that that data collection is accurate and giving us the picture that we really need. I think the other difficulty that we're facing right now, and Commissioner Lee certainly addressed some of this, and I think they're doing a really great job of trying to help overcome some of the disparities that are going on right now by offering the flexibility, by not kicking anybody off Medicaid, by looking for those individuals that don't have access to telehealth, and what do you do about that? And honestly, I think the best we can do right now is make sure that we are communicating. Kentucky Voices for Health has a really great explainer by taking all of the technical information that we're hearing and trying to distill it down into easy to understand information. And that's one step, but we need to be able to get that information out. And so I think it's important that we are talking with communities, the people in the community that work on a day-to-day basis, kind of on the front lines with the people that are experiencing these disparities. And the way you do that is looking for neighborhood association leaders, faith-based leaders, school teachers. You really want to look for those community champions, and those are the individuals we should be trying to communicate with on a regular basis, because they are communicating with these communities and understanding who is not getting the information, and what's happening, what's the barrier to getting them access. Because I think what we're seeing is that they're not getting a lot of the information, or they're not understanding the information in the terms that it's being delivered. So we have to be able to make sure that our communication resonates with these communities.
Thank you, Veronica. I didn't know if Dr. Grigsby or Dr. Stone want to chime in, since you guys are providers.
I just wanted to say a quick thank you, because I do feel like that Commissioner Lee and her team have really made it much easier for us to be able to reach out to patients in different ways. The fact that it's become so, there's so many modalities that we can reach out to patients. If you don't have a computer, if you don't have internet access, but you do have a phone, we can talk to you on the phone. And in this day and time, we have providers who are just sitting by, typically during the day, we're all running around seeing patients in person. Now we actually have a team that's sitting there waiting for calls, waiting for telehealth or telecare visits. And I really can't tell you how much I appreciate the fact that we've opened up all of these modalities to be able to reach out to patients and connect with them in innovative ways. Much appreciated. Thank you.
This is Nikki Stone, and I'm a dentist in Kentucky, in rural Kentucky, and I would echo what everyone has said here. Definitely the ability to provide a teledentistry visit just via a telephone for the group of people that we particularly are treating has been a life send. And I know a lot of people have talked a lot about how they want everything to go back to normal after this. I do not. I want us to keep some of these flexibilities in place, because it is so needed for a lot of these families. The struggles that they're facing with not having Wi-Fi, not having broadband, not having a computer at home. They can't do Zoom. These are things that we now know how badly we need them, and I don't want things to go back to normal. I would love for us to keep a lot of these flexibilities and relaxed policies in place.
Thank you both. You kind of led into the second question that I had. We've heard the great changes that have been made about access to care, but we also know that there's some unintentional consequences, and there's things that are going to have to change after COVID. Especially for the populations who are currently underserved. So I don't know if Dr. Grigsby, if you want to share anything else on that note.
We all kind of chuckle about this, but we're like, we're never going to get some of these families back into the office, because it's so nice for them to be able to connect with us without getting all the children in the car and coming to the office. And it really has been a wonderful transition, and just having these abilities to connect with patients that have struggled to connect with us in person. We're still trying to make sure that families know that we're there if they need to bring that child in, and there are children that need to physically see us. The infants, the young children that need vaccinations. There are certain children that are not appropriate for telecare. And so we've worked a lot with those families too to say, you know, we're trying to make this as safe as possible. In fact, for instance, a lot of providers have flipped their days from, they may have some sick visit days to well visit days, or in our case, we have a sick visit site and a well visit site. So we're trying to separate folks to make parents feel as comfortable as possible bringing their child into the healthcare system right now. I don't think that I think the wonderful news is that telecare is here to stay in some format, and that's wonderful because there are visits that we can very easily do that's much more convenient for the family. That I think we were slow to adopt the technology, and now we've been forced to adopt the technology, and I think it's going to be tremendously helpful for patients going into the future. So while I agree with Dr. Stone, I think we would like for things to get back to normal, but what is normal now is not what was going on before. And I think that's a positive for patients and families.
And this is Dr. Stone again, I would say that in particular with dentistry, we are predominantly a hands-on occupation. So we are definitely going to have to get back to the point where patients can come in. We're going to face a lot of challenges in the dental field with increased costs of providing care. This happened back in the 80s with the HIV/AIDS epidemic, and what came out of it was a lot of good because we began wearing gloves for the first time and focusing on infection control so that we didn't transfer that disease from one patient to another or to the dental staff themselves. And right now with COVID-19, the dental hygienist is listed as the #1 highest risk of contracting that. Dentist and dental assistant are also kind of round out the top 5 besides operating room folks and respiratory therapists. We cannot treat a patient who's wearing a mask. They have to have that off. And we also generate aerosols. And this is a tiny, tiny airborne virus. So we're going to have a lot of increased costs moving forward with either changes to our building or changes to the way that we provide care or an increased amount of personal protective equipment. So we're probably going to be looking at needing to increase the payments made to dentists for providing this type of care, or we're going to lose a lot of the ones who are currently seeing some of those patients just because they can't afford to do that.
Thank you. It kind of segues perfectly into Veronica, if you have any additional policy changes or funding that's needed. I know Dr. Stone talked about payment, and Dr. Grigsby mentioned telehealth, but other than that, are there any additional things that we need to consider?
Well, I do want to mention, because one thing I think they've highlighted is that confidence in safety, right? Do we want people have to have confidence that they are safe to go back into people's businesses. And this is this is central, I think, to reopening business, not just healthcare, but all businesses back in Kentucky. And so we have to think about, what does that look like? Does that mean people are wearing masks? Are people wearing gloves? Is PPE readily available for everybody, for our healthcare providers? And I do think some of those policies are going to have to be driven very much by the industry. So each of these provider types are really going to have to let government know, let the governor know, let Commissioner Lee know what are the needs to try to make sure that when we do open our offices back up, what does that safety look like? I don't think anybody really has the answers, but I think that we're talking about it, and certainly providers have to be in that conversation to let us know what that is, much like the governor called for businesses to submit those particulars to him so that their task force can develop what does that look like and what is needed. But without people being confident in their safety, they're not going to come back to the office. So we have to have testing available. People need to know whether or not they have the antibodies and they're not able to further spread the infection. And these things, regrettably, won't be happening for months. They talk about a vaccine probably won't be here till next year. So I think the policies that we continue to implement and maintain are ones that continue to allow for telehealth. But then where can we relax some of that for in-person care, like Dr. Stone had talked about. The payments to providers is critical. When the small business loans came out, there was not a specific exception to some of our healthcare providers that weren't eligible for it. So you're looking at those healthcare providers not being able to possibly sustain the economic impact that they're feeling. Again, those dollars ran out very quickly. So some of our providers might not have even been able to access those funds. So I definitely think, and the federal government, I think, is doing this, is looking at how much additional funding do we need to bring into the communities, to the states, to providers, to businesses, to make sure that they are here when we come out of the pandemic itself.
Thank you, Veronica. And I'm glad that Commissioner Lisa Lee is still here listening to all of this as well. So I just had a question for our providers that are on Dr. Stone and Dr. Grigsby. What's the top advice regarding individual healthcare and access that you would like to pass on to organizations for themselves, but also to share with those that they serve? Dr. Stone, do you want to take it?
Would you like me to talk about our infographic, Mahak? Okay. So as far as consumers go, we have a one-page infographic that was developed in conjunction with basically all of the dental organizations across the state and the universities. And this is guidance that we would like to get out through to the public, as well as to the dental offices, medical offices, to kind of share. So basically we're looking at only 3 very limited scenarios for patients that would need to go into the actual hospital emergency room. And those are just uncontrolled bleeding, pain or swelling that is interfering with a patient's ability to breathe or swallow. Those are true emergencies, or any kind of trauma to the face that is interfering with their ability to breathe or swallow. Other than that, anything that's elective, we are still in a state of just rescheduling those or postponing those altogether: exams, cleanings, x-rays, even regular routine fillings and all that. So what we're dealing with from a definition standpoint is only urgent dental needs. So emergencies are going to the operating room. Urgent dental needs such as toothaches, broken teeth, lost crowns, braces, wire that's poking somebody in the cheek and hurting. Those are the things that we're dealing with in the dental office. For the most part, what we want is for a patient to go ahead and call that dental office to be sure, when can I come in? How do I come in? Do I sit in the car and wait before I walk in until the room is ready for me, so that we don't have people in a waiting room together, and those kinds of things. And most dental offices appear to be closed, but if you call, a lot of them are meeting you there and coming in to deal with those urgent situations. And then our network of primary care providers, federally qualified health centers, and community health centers across the state, there are 18 of those. All of those are open and actually seeing these, as well as the 2 universities. So
great. Dr. Grigsby?
Yes. So what I would advise families is to call your provider. If you have concerns, call your provider. We are limited to what's considered urgent visits, but thankfully the American Academy of Pediatrics and the governor's office has said, you know, we feel like that well child care for young children under the age of 2, particularly if they need vaccines, is an urgent need. We were very concerned when all of this started that we would trade one pretty significant problem for another, and that we would have all of these young children that weren't effectively protected if they couldn't get in to get their vaccines. And so what I would urge families to do is to call your provider's office and see how they're handling these things right now. We do have the ability, thankfully, to the commissioner and her team to do older children via telehealth and then to finish up those visits later. So my best advice to families is please don't be concerned that your child is sick and that you have no options to reach out. Reach out to your provider's office. If for some reason you can't reach your provider's office doesn't have coverage, reach out, you know, to your local health department or to your local hospital to get advice, because we don't want families sitting there thinking that they can't reach out for advice or for healthcare concerns, and also that children continue to get those really important vaccines at a young age, so that we don't in 6 months have an outbreak of some of these infections that we don't see in the state because we've done such a good job of vaccinating our children.
Thank you. That was helpful. Veronica, do you have anything else to add in?
I think they've done a good job of highlighting what those needs are.
Great. Well, we have a couple questions in the chat that I think that since we have time, we could go ahead and answer, or at least ask them, and hopefully we have answers to. So Megan Metcalf had shared, I help a lot of families with kids who are being cared for by caregiver relatives, not parents. Most do not have formal custody orders, and while courts are closed, unlikely anytime soon, there's a barrier for serious emergencies. So what can we be doing to get these families and kids access to Medicaid and telehealth if they don't have legal custody? If Commissioner Lee, if you're still on, you might be the best to answer this.
And I would say right now, I mean, if anyone has a child who needs access to Medicaid and they are not Medicaid eligible, the quickest route to get them eligible may be that presumptive eligibility form that's online, because it is not age specific and it is for the individual. And since that child would not have any income, I would just go ahead and recommend they do that presumptive eligibility. Otherwise, they would have to do the full application, and if we needed additional information, we wouldn't be able to get it. But that presumptive eligibility application would at least get them in the system for a few months until they could figure out how to get the full eligibility based on court proceedings and other things that they needed to do. But and I'm looking at Veronica. I know she used to be worked in Medicaid too, so I always look to her too to kind of back up what I say. Veronica, do you have anything to add to that? Do you agree that would be the quickest way to get them into the system, those children?
I do. I think what's a really important to note is that when you apply for that application or when you come into that provider, they're going to do whatever they need to do in terms of, the concerns about whether the person's the guardian of the child who's helping them apply or who's helping them access that care. That's kind of the least concern if that child needs either coverage or access to a service. And so those I'm hoping that if people are running into that problem that's being escalated to Commissioner Lee's attention or within the provider, somehow being escalated, and you should escalate it because no child is denied either coverage or access to a service because there's a potential guardianship issue on, whether that person has the legal capacity to seek the care or that coverage for that child.
Thank you. I appreciate it. We had another question that was specific to dentistry. Dr. Stone, do you not see any opportunities for telehealth in non-emergent situations after COVID-19? This individual saying, just thinking about the cost saving and access to families, especially in the rural and urban areas.
Absolutely, yes. And we're actually working toward teledentistry in our state before this happened. And then it just kind of suddenly appeared. So we're working out how to do that now. But we are very hopeful that it will continue. I think especially those initial conversations about what's going on, whether someone needs an antibiotic before they're going to come in. So definitely in the realm of emergency dental care, it's definitely still going to be a good option for accessing care and all of that. I'm also especially excited about the possibility of using teledentistry in an outreach capacity moving forward, getting into the schools and checking on those children. There are some fancy intraoral cameras that we're looking at, and there's a lot of funding out there right now for teledentistry. And so many more people can receive dental care, or at least that initial visit and assessment through teledentistry, and I am extremely excited about that moving forward.
Great, thank you. So one last question. This is for Commissioner Lee. So with the new presumptive eligibility coverage, are DMS or DCPS hearing many questions or concerns from Medicaid beneficiaries who are having trouble getting services, or are the questions or concerns primarily coming from providers related to whether coverage is legitimate?
So the questions are mainly coming from providers, because prior to this, we had presumptive eligibility. We've had presumptive eligibility for pregnant women for many, many years in the state, and then we went to the hospital presumptive eligibility. And most of those individuals, when they do the presumptive eligibility application, within a day or so would go into the system. They would have full Medicaid eligibility, so they didn't really used to have that card. And again, the card does look a little suspect because it's just a piece of paper. And I think the other important thing to know about presumptive eligibility for these individuals coming into the program now, we wanted to make it very easy for them and very streamlined. So the individuals coming in through the presumptive eligibility process right now are not assigned to a managed care organization. So that streamlines things a little bit better as far as accessing services. The provider doesn't have to worry about how to bill or anything. They just bill straight to the department. So we're getting out that information. Again, I'd like to send you the letter that we sent to the provider so you can post it, or you could help get information out there that this is a legitimate service. And when the individuals have that card, that they are Medicaid eligible, and Medicaid will pay for that claim.
Thank you. That's really helpful. Well, I just want to, again, thank you each for being on today. This was really helpful information, and you each are a wealth of knowledge, and I respect and appreciate each of you also. Thank you so much. I'm going to turn it over to Jessie, I believe.
Yeah, I will just echo what Mahak said. Thank you to all of you panelists for joining us today. Thank you to the partners who submitted really insightful questions in advance and who just asked a lot of great questions in the chat. I will, in the follow-up email, be sending out some of the links that folks were talking about today. I'll send those out in the email so that you can check those out and share them as needed. And then those of you that asked some specific questions but didn't get them answered, we're going to try and find answers for you and follow up with you. Before I turn this over to Terry to say his final remarks, just a heads up that we will be having another virtual forum next Wednesday at 10 a.m. And we're going to be looking back at the 2020 Kentucky General Assembly, because remember that happened and just finished. And then we are also going to be looking ahead to 2021, including our state's legislative and budget priorities related to COVID-19 recovery. And we will have a couple of legislators joining us for that one. So we'll also send out the link to RSVP for that forum in the follow-up email. So at this point, I'm going to turn it over to Terry Brooks to see if he has any final remarks for us today.
See you, but I will take just a second to echo what I'm sure we're all feeling, which is it is so terrific to have 4 such knowledgeable voices who know their stuff, who listen so well, who can be flexible and creative in their response for kids and families. In the midst of this, special shout out to the commissioner. We know you've got to be incredibly busy, and you giving us this amount of time means a whole lot. I'm also just want to make one other request or hope. I love the fact that, for instance, there's so many cross-sector folks joining this call today. We saw the same thing in prior calls around early childhood or juvenile justice or child welfare. All of you are champions for Kentucky's kids. And therefore, we know that the issues that always affect, afflict, and uplift kids cut across sectors. That's never more true than in this pandemic. I mean, kids are not living in the pandemic in silos. So health affects child welfare, and child welfare affects early childhood, and early childhood affects health. So I just want to encourage and ask and invite you to be part of these Wednesday virtual town meetings every week. We're trying to paint a gestalt of what kids and families are going through. And so when you see a topic, don't ever think, well, that's not my thing. Because if you're about kids, we need you coached up, knowledgeable, and having a full-throated voice about every issue that affects kids in the pandemic. Thanks for giving us this time today. We hope you find these productive. Again, special thanks to our guest. Special shout out to Lisa for being here. Thank you so much, Commissioner. Thanks for joining us. And Jesse, back to you.
All right, well, I will just say thank you all and have a great rest of your week. And thank you for all you do for kids. And we will see you next Wednesday, if not before.
Thank you.
Thanks.
Bye-bye.
Bye, everyone.
Thank you.